Creator Studio, and we have a very interesting show planned for you this morning. So you definitely need to stay tuned in if you've joined us, and if you are tuned in and you want to tell a friend to tell a friend to check out Health Vibes. Always a great opportunity to get some fresh new information about health, very helpful information, and of course, to always just vibes as we always do. It is the beautiful month of May. So, for anyone listening to me and anyone who knows Trudy, they know that May and Trudy are one and the same. So this is my birthday month. It is the best month of the year, and I just want to send a shout out this morning to all my lovely Mayborns. I know you all are just as excited as I am. May is turning out to be a very hot month, but as usual, a very nice month, very nice comfortable month where nice things happen. So, if you're listening to me this morning and you were born in the month of May, I just want to give you birthday shout out, birthday greetings, because May is that month. Our chief host, Mr. Langdo, knows a lot about the month of May because he made a wise selection in terms of getting a Mayborn wife. So, Carlton, I was just, good morning to you.
Good morning to you, my friend Trudy. Good morning.
I was just bigging up the month of May. I
Yes,
was
your
bigging up the
month.
month of May. Yes, definitely the best month, Carlton. We're not June.
Why? Maybe people hot. Maybe people hot and maybe people can be a little stubborn. Taurus people. Oh my God. Taurus people. But they're wonderful. They love from the soul. I must say that.
That's
When
it.
they love committedly and they really become your rider or die.
You're right. That's
That
it.
is true.
That's my main problem. But anyway, that's another show.
That is really true.
That is
Yeah. And they
another
give very
show.
good gifts. If you're dating them, they give very good gifts. But you have to earn the gift. Yeah?
Right.
You have to earn it. So you have to put in the work to get those gifts.
That's right.
All right.
That's right.
Trudy, good morning to you, my dear. I'm
Good
running a little
morning.
late because I came from the mega store in Fokole. I worked there this morning until I had to get ready for work for the show. But packing can be sometimes.
Yes. Although Carlton, it's a little easier for me since the cruise ships have stopped being regular. I mean, I know for the people in the tourism industry, the taxi drivers and the vendors and so on, they maybe miss the cruise ships. But for me, as someone trying to pack in the city, the absence of the cruise ships is a good thing for me. So I get to pack, I think, a little bit quicker than when there's a cruise ship in port. Definitely. So it was a bit easier for me today.
Awesome. I love your necklace.
Thank you. We're
Very,
getting
very
up
pretty.
getting up for the birthday, Carlton.
yeah.
That's tomorrow. So I have to start with a gradual increase.
I suspect I may see you at some hotel at a pool.
That is my plan.
Yeah, I suspect that. I suspect that. With a champagne in your hand.
Right. That's the plan.
My friend, live like there is no more hour or minutes. And I agree. Leave before you leave.
That is true.
That's it.
That is true.
But good morning to you. Good morning. We're so happy that you've joined us for yet another episode of Health Vibes. This morning, again, we have a very educational show for you. We're going to go through this very slowly. We want you to take notes because many of you may have made errors in the past that could have saved you money if you only knew better. And that topic that we're going to discuss was actually one that was suggested by an avid listener who said to me about 2 weeks ago that we should discuss this because many people don't know, and sometimes it can actually get them a better diagnosis,
Right.
save them money,
Mm-hmm.
and save them time.
Right.
And so we're going to be discussing that this morning. But
Yeah.
before we do so, I just want to again let the public know that next week, Wednesday and Thursday, we are putting on a female reproductive and sexual health screening.
Mm-hmm.
So that is for females,
Yes.
ladies, women of the age of 18
Mm-hmm.
all the way to about maybe 60,
Mhm.
I would think.
Mhm.
We will be putting on a pap smear and breast examination clinic. So if you're listening, take note of that. You may not have had a pap smear in a while, or you may have wanted to do a pap smear but may not have felt comfortable with the healthcare provider offering that service.
Mhm.
We now give you that opportunity to have it done privately with professional, mature individuals. So the healthcare providers are both retired nurses, those that will be doing the pap smear and the breast examination. So we have Nurse Daisy Bay
Mhm.
from the Cancer Society. People most know Nurse Daisy Bay, and we have Nurse um, oh, why her name just slipped my
Her name
mind.
slipped you.
From the Granby district, she was the FMP nurse there. It will come to my mind
Yes.
shortly, but I just can't remember her name right now. But she's going to be the one. These are the two nurses that will be with us for 2 days. So we have extended it for 2 days.
Okay.
We really want to thank Lafales Lab for really, really partnering with us and making this a worthwhile venture for partnering with us. So I want to really thank Andre Fortune and his team, Dr. Jolie Bossante.
Mhm.
So she's going to be there as well. So if, for example, something is seen, she can come and then you can get a
Consultation,
prescription
okay.
right there, do the consultation right there. And if has to be a referral to say an OBGYN, that will be done as well. And so we want you to call Jolly's Pharmacy 448-3388 to book your name. So you can book your name and you will get a time slot. We are charging $40 for this, so $40. And that is really a giveaway.
Mhm.
$40 in a very comfortable space. And you will feel very, very Nurse Commodore.
Nurse Commodore.
Yes.
Okay.
So the name
so
was,
Nurse
I was
Desabe
still
and Nurse
Nurse
Commodore.
Commodore,
Okay.
FMP Commodore. She was the FMP for the Granby Health District for many, many years.
Okay.
And she's a well-respected consummate professional. And so she has agreed to render her services to do this for Dominica.
Nice.
The same as Nurse Daisy Bay. So 2 senior nurses that you would feel very comfortable with to have your pap smear done and your breast examination done.
Right. So
All
that's
right.
next week, Wednesday and Thursday, the 24th
Yes.
and the 25th.
Yes. So
From what time?
10, the clinic starts at 9 and
Okay.
ends at 4.
Okay. So they can call in advance, book a time slot.
Yes.
And anytime between 9 and 4, they can get that service.
Yes.
Okay.
Yes.
Okay. And as a woman who has done, pap smears all the time, I can tell you the $40 fee is a giveaway.
Mhm.
If you had to go private, it would not be so affordable. So
Yes.
yes, so it's a good opportunity, as Carlton is saying, to get that done. Especially some people have never done one. So if you've never done a pap smear, this is your opportunity. It is the screen for cervical cancer, and it's necessary for that screening, and the breast exam too. So I think it's a definite worthwhile endeavor, Carlton.
Definitely.
And I applaud Jolly's Pharmacy as usual for looking out for the best interest of the population, and in this instance the female population.
Yes.
And that's who I advocate for.
Very true.
Yes, so that's good.
Yes. So we'll be having that next week again. next week, Wednesday and Thursday at Bossate Medical Office. That is right opposite the first wing of the Wesley High School on Hillsborough Street. So if you've left the Jolly's Pharmacy close to All Saints, you just take a little walk down way before Starrings and Son, you will see the sign Borsati. So that's the clinic that we're going to be utilizing on these 2 days to have that service offered to you. So whether you live in Boetica or you live in La Plaine or you live in Bataka, you can still come. You book your name, we give you a time slot, and you come down and you have your examination done.
Good.
When your results come, you will get a call. All the results will go across to Dr. Charlie's office. They'll call you and will tell you what's happening with your results. Okay. So that's what's happening. On Saturday, this Saturday, we are having our chip, your dip competition. And we've gotten participants. We have the Georges, they're ready. And this is to promote the St. Mary's chips, which is our signature chip on island. And somebody will get $1,000 in cash, the winner that is, and will also get the opportunity to start off a business.
Oh, nice.
So the ingredients will be selected by the Georges. You will not know what the ingredients are until the day of the competition, which is on Saturday. And you will start making whatever you have to make. It is going to be live. And ultimately, the Georges will be doing the testing and will select
the best winner. One. Okay.
Yes. So somebody will get an opportunity to actually start off a business.
To make that dip and sell.
That's it.
Okay. Good.
That's it. So, we're thinking of all different ways that we can help our people, ingenuiting ideas. So we really want you to come on and support. The names have been submitted and we've already selected the finalists. And so all you can do now is support.
Okay.
Yes. Support. Okay. So that's going to be happening on Saturday, this coming Saturday at the Mega Store in Fokole from 11 o'clock in the morning.
Okay.
Yes. So Trudy, what we're going to do, we're going to take a short break and then we will get into today's topic and start dialoguing.
I woke up this morning feeling resting. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. Great and down in the street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and take on any mission. If you see me again, Jolly's Pharmacy is number one, Jolly's working. We cater for everyone, Jolly's working. Boost up your immune system, Jolly's working. Yeah. Yo, Dominic, it's your boy Father Fox. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare. Introducing Jolly's Pharmacy, brand new website, www.jollys.dm. It's your time to jump the line. Shop now at jollys.dm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollys.dm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollys.dm. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience can make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping, Dominica. You could be shopping and having fun. Shopping. With your daughter or with your son. Shopping. Cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping, Dominica. You could be shopping and having fun. Shopping. Papa and mama alone. Shopping. We cater to everyone. What a happy place. some more any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor, and not forgetting lots of vibes. Hosted by Carlton Lando with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
So now it is 10:35. We are back with you on Health Vibes, your main health talk show each week at this time. And today we are really going to give you some vital information relating to some medical experts that you may not know of. As a pharmacist, many times calls we receive calls where people inquire about I'm experiencing XYZ, which doctor should I go to?
Right.
We get that all the time. People don't know the different specialities. They may have heard of them and don't know exactly what they entail. And so today we're going to break that down for you. There are some that may not be available in Dominica. Sometimes you would have to be referred by a local specialist here to see that subspecialist or that other key specialist in another country. But at the same time, we would want you to know the real reason why you would have to see that particular individual or specialist.
Right. And Carlton, too, oftentimes, as you mentioned, people call and ask which doctor to see. Sometimes people are not very in tune with what is available, so they may choose a doctor just off the cuff. They've just heard about this doctor, and as you mentioned earlier, spend money in seeing this person when really they could have seen somebody else and gotten their issue properly addressed on the first try, instead of having to get a referral to another person. So I think it is definite good information that we're going to share. And if you do have the ability to take some notes and you've always wondered, what doctor should I see for this particular issue? Now is the time to take some notes.
Very true.
Yes.
Very, very true. So we're going to begin with the general practitioner. Most of us would have heard about the GP, general practitioner. What do they do? So the general practitioner, or usually called the family physician, basically is one who cares for the entire family. So from children to the elderly to any given basic care. All right. They do routine blood pressure, your blood glucose. They may send you to do certain blood tests. But when they recognize that there is a major problem, they would normally refer you to a specialist.
Right.
So the GP is usually the first line after the nurse, the first line of person that you would see, particularly if you just want a general checkup. A
general checkup, a medical. If you maybe have something acute like a flu that's not going away, or diarrhea or something like that. You have something acute, something that is it's happening right away, and you need to see somebody urgently. You choose your general practitioner. And what I would say for this, Carlton, there are many general practitioners, and I think it's a good idea for people to kind of zone in and have a general practitioner that they like and that they trust and that they normally go to, so that this person has a history that they can follow of your medical, because oftentimes sometimes people jump from doctor to doctor and then it's hard to follow through because this doctor doesn't know what happened with that other doctor. And so in terms of a general practitioner, I think it's a good idea to select one that you go to when you need just general medical service.
Excellent. Well said.
Mhm.
The next one, a pediatrician. Pediatrician. So the pediatrician basically is the specialist that deals with children and diseases affecting children.
Mhm.
All right. So the pediatrician is one who cares from birth unto adolescence. So if you have a young child, 3, 4 years, you'd really want to take the child to their pediatrician, particularly if you just want a full assessment in terms of the child's growth, in terms of the child's cognitive development. You know, you would take your baby or your young child to
A
the
pediatrician.
Okay.
And we do have available on
Yes,
island.
we
do have
pediatrician
pediatricians on
the
island.
Right. So we are getting to the obstetrician gynecologists, or what we call OBGYN. Those are very popular. We do have
We have several
yes,
OBGYNs.
we have.
It's popular, but still sometimes it's a long wait to see an OBGYN.
Yes.
So it's not like it's a specialty that's underutilized.
That's true.
All the OBGYNs, I think, have big clientele because they deal with women's reproductive health issues, and for obstetrics in specifically baby
Babies,
delivering,
yes.
the delivery of a baby. So of course, half the population is female. So these particular specialists have a lot of work for them. I don't think any of them are without work.
Yes.
Yes.
And they also do surgeries as well.
Right, exactly.
Right, so
Female
it's surgery.
gynecological surgeries.
Yes.
So sometimes, Carlton, and I want to talk about this specialty because sometimes women have certain issues, and they are kind of thinking of going to a doctor. They might choose a general practitioner. But if it's some sort of issue to do with your menstrual cycle, to do with your ability to have children, or you're trying to have a child or something, or if you experiencing certain pelvic pain, this general area, the pelvic area, which is where your uterus is, your ovaries are, you should definitely try to see an OBGYN and not just go to a general practitioner. If you've been concerned that you may have some sort of reproductive issue like PCOS, or maybe you think fibroids or something, or you're not getting a period, or you're getting too frequent periods, or you're getting extremely heavy painful periods, you want to seek out the help of an OBGYN. Some women will ask me, how do I get a diagnosis for PCOS? That's polycystic ovarian syndrome. And I tell them, well, your first step is to make an appointment
and get
with
the confirmation.
And the OBGYN will guide you through, the different steps to get a diagnosis.
And not forgetting the breast as well.
Right. Yes. Right. So the pelvic area, the reproductive organs there, but also the breast. And my OBGYN always does a breast exam for me, with my yearly visit. So yes, the breast health as well, breast and reproductive organs.
Definitely. So we get to the ear, nose, and throat specialists.
ENT.
Right. Ear, nose, and throat specialists. We have two on island, one in at the hospital and one in private practice.
Okay.
Yes. And so this is a doctor that deals with issues of the ear, the nose, and the throat. Right? So it's clear cut. You're having chronic sinusitis. You find that you sneezing a lot every morning. You maybe sneezing for the first hour. You're wondering what's happening. Or you always have an issue with your ear, or you recognize you're not hearing very clearly in one of the ear. You have to be straining to hear. Or you recognize that there is something irritating your throat, issues with your throat. You're always getting sore throat. You're always having some issue. Then you would need to see the ear, nose, and throat specialist.
Right. Carlton, and something I think maybe some people or people don't know is related to the ear is your sense of balance. Balance originates from the fluid in the ear and how it is, positioned. So there are some people that suffer from, constant issues of feeling dizzy, or off balance. Vertigo is called. And the ENT is the specialist for this.
Yes.
So it's interesting that sometimes people may not correlate a
Yes.
feeling of being dizzy all the time or off balance to the ear.
That's true.
But that is the origin. So the ENT
Yes.
is the person to see for this particular feeling or issue. That's where you should start off.
Very true.
Mhm.
Very true. And they also deal with certain diagnosis of certain cancers,
Mhm.
cancers of the throat, the ear, and the nasal cavity
Right.
as well. And they also perform surgeries.
Right.
I remember there was a time when my nephew, when he was much younger, I think about 2 years, had swallowed $1.
Wow.
Yes, and Dr. Pascal was called
Mhm.
to get it off. And you wonder, what did he do? But he get it off.
Hmm.
So it is something that is quite interesting. They deal with all of these matters as well.
Mhm.
Then we get to the oncologists. Oncologists are the specialty that deal with cancers, tumors. All right, so cancers and tumors, anything to do with a diagnosis of cancer, they will refer you now to the oncologist, who will be the one to administer the radiation, the chemotherapy, and monitor what's happening with the cancer.
Yeah,
Mhm.
and for that particular specialist, Carlton, the oncologist, that is one you would not just go to on your own, like
That's
how
it.
we mentioned the
Yes.
OBGYN, you
You
can
have to
choose
be-
to,
yes.
you have to be referred
Good.
to an oncologist. So the
Yes.
diagnosis would have to be made
Mhm.
elsewhere, and then the oncologist will handle the treatment plan
Yes.
for the cancer, you know. So this one I wanted to
Yes.
insert that
That's
you
very
cannot
true.
just decide, boy,
Oh, I assume that
I
feel like
assume
have
I
a
feel I
cancer.
have a
Mhm.
I feel I have a cancer, because you know when you go on Google, cancer is the diagnosis for all aches, pains, you know. So you cannot just say, boy, according to what I saw online, I need to go to an oncologist. You need to be referred to an oncologist after the diagnosis is made.
Yes.
Yeah. So just putting that
So,
out there.
Very true. Very true.
Mhm.
Then we have the neonatologists. I remember we had Dr. Lambert, who was a neonatologist here. We have now Dr.
David, I believe.
Dr. Chanel David.
Mhm.
No, this is a subspecialty of pediatrics.
Okay.
So you would have done pediatrics, but then subspecialize in neonatology. That is the study of newborns. So babies that have been born, particularly those who were born with major complications or
Okay.
crisis. So this is the expert that deals with these new babies that may have been born with a heart defect or a breathing problem, or the baby has to be in ICU. The neonatologist is the expert that deals with that aspect.
Right.
Right. So again, you don't just walk to an
Right.
neonatologist. You would
be
have to get the
referred
referral to
for to see the baby.
Yes,
Okay.
yes, to see the neonatologist.
And I assume too, if you have a premature baby,
Yes,
the services of a neonatologist is important.
Yes.
Yes.
Especially as it relates to growth and nutrition.
Mhm.
Because also the vital organs are not fully developed, and certain dosages would have to be tailored to meet that child's need
Needs.
and to preserve and protect some of those vital organs, particularly the kidneys and the liver.
Right.
Okay.
Yeah.
Then we have the orthopedists.
Mhm. Or sometimes we say the orthopedic surgeon.
Yes.
As well.
Yes.
And we have several locally.
We do.
Mhm.
So those are doctors that deals with the skeletal muscular system. So to do the bones.
Mhm.
You see terrible accidents where people had major fractures in their feet or arms. These doctors come in and they do their magic to they use bolts and screws and all kind of things to get those bones and stuff back in place. So that is an area. So you have deformities, you have injuries of the skeletal, the bones. These are the doctors that take care of that.
Yeah, Carlton, so something you maybe don't know, and I will share. I have a very close relationship with orthopedic surgeons. I had a major surgery when I was 11, and I have 2 metal screws in my hips.
Wow.
So interestingly, as we're speaking about doctors, at that time, I'm not giving out my age, but at that time we did not have an orthopedic surgeon here. Now we have, I believe, 3 of them
Yes.
available,
Yes.
local,
Yes.
right, on
Yes.
island. So at the time, the issue I was experiencing pain every time I sat for long periods and would get up, I would have pain, and I finally went to Dr. Paul, who was a general practitioner. So you start
And
off,
surgeon.
yes, and surgeon,
Mhm.
and got an X-ray, saw the issue, and then was referred to the orthopedic surgeon in Martinique. So I had to go overseas.
Mhm.
So the orthopedic surgeons now in Dominica can do the procedure that I
Yes.
had done
Yes.
in Martinique. So there has been big development
Mhm.
in that area. So some of these corrective surgeries, you have a bone that, in my case, slipping out of place, and you need corrective surgery. You have some spinal deformity,
Mhm.
right? You need it to be straightened, or these doctors, so not just accidents, but sometimes people just have deformities that need
True.
correction of their bone structure
Mhm.
has some deformity that requires correction.
Mhm.
Yeah.
I know of people who have had, one leg,
Longer than the other. Well, yes. How I
know.
am now, one leg of mine is slightly longer because
Ah.
of that issue.
Yes.
Yes, very slightly. So although I did have the corrective surgery, I have a slightly longer limb.
Right.
Yeah.
I too had reconstructive surgery done to my elbow. You can see my scar right
Okay.
here and here in Barbados, and that was done by an orthopedist who had subspecialty in hand injury, Dr. Winston Seal. And I have screws and metal in there too.
Okay.
So when it's the cold season, I suffer.
You
a bit.
feel it, yeah.
The fan is blowing on there. I get it. Yes.
Carlton, as you mentioned that too, also issues with arthritis. So
Yes.
osteoarthritis is a big
Yes.
problem in the population. These are the doctors that you would go to for arthritic issues. It
That's
could be rheumatoid or osteoarthritis, or if you have what's the other one? Even gouty arthritis.
Yes.
These
Bones are
physicians,
softening, the cartilage is wearing out.
right? These are the physicians for that. These are the specialists,
Yeah.
the orthopedic surgeons for that.
You have a split disc, you have a pinched nerve,
Right.
these types of things. All right. All right. So then we have the neurologists. Neuro. So you're thinking of neurons, you're thinking of brain, you're thinking of these things, the neurologists. I call these guys the smart guys, because really they get into the spine, they get into the brain, and you don't know what's happening. You're wondering if when you get up, you will remember your name or your age. And these guys, they often do magic. And I think that is why that specialty is so expensive, very to the brain surgery. So these are the doctors that really deal with brain, nerves, and spinal cord. So even you would have seen, let us say, the orthopedist for let's say, herniated disc. And then that orthopedist may refer you to the neurologist to do the surgery.
Okay.
Yes. And even if they would still have an orthopedist in the team, but the neurologist would have to be the one to deal with the nerves
The
and all of
spine,
that.
yes,
The
the
spine
spinal cord.
and that, yes. All right. And they are also the ones that actually best in diagnosing Alzheimer's, Parkinson's disease as well, and epilepsy, and even stroke. They understand these things because, again, all of these diseases are related to the
brain, right? And of course, the brain and the spinal cord, our central nervous system, that's our control. That's the control system of the body, right? So very critical in terms of its function. And the specialist dealing with that area, very crucial. I notice I don't think we have a local person, but I notice we have
Cuban now.
Right. And I noticed we also have have a, what you call it, clinics for somebody else's
Yes,
office
that's true.
for neurology.
Yes. So I see
So
we have somebody.
Mhm.
Yes, somebody now on island. I
yes,
think she's a Cuban who is offering that service.
Right.
Yes, that's true. Then we have the geriatrician. The geriatrician, we do not have one
in
on island
Dominica,
yet.
no.
But it's a specialist that deals with the elderly, diseases of the elderly. So you have the pediatrician that deals with a baby, from a child all the way to adolescents. Then
Mhm.
you have now the geriatrician that deals with the elderly. We do not have one on island,
Mhm.
but many times the general practitioners they work with the elderly
Mhm.
and subspecialities. So sometimes they go to other specialists too.
And interestingly, in Dominica, I think what has happened is we ended up with like certain general practitioners who are known for certain
Yes, it's
areas.
true.
So, for instance, I remember when the late Dr. Ricketts was here, he saw a lot of elderly
Yes,
patients. Even Dr. Cools, who no longer practices
that's true.
here,
Yeah, he
would see a
too.
lot of elderly patients.
Mhm.
So even
And
if
Dr. Grell.
even if they were general practitioners,
Mhm.
you know, they would their target market, just maybe based on their demeanor, their interest, ended up being, you know, elderly
Dr. Mack as well.
patients. Yeah, Dr.
Dr.
McIntyre.
Mack too.
Yes. So it's we don't have a specialist, but there are certain general practitioners who tend to see the elderly a bit more frequently. Mhm.
Then we have the rheumatologists. I have a friend who just completed studies in that. Unfortunately, he's working in Antigua,
Mhm.
but he did subspecialty, well, specialize in rheumatology. And that is the specialist that diagnoses and treats allergies and your autoimmune system. So if you are having allergies, a lot of allergies, sometimes you don't know what is causing the allergies, your skin has just changed, you're getting sick all the time. They are so they kind of closely linked with the immunologists.
Mhm.
Yes, but they also deal with treatment of the joint and tissue, which basically is linked to the immune system.
Right. So these specialists, people with autoimmune diseases
That's
like
it.
lupus,
Uh-huh.
tend to need to see a rheumatologist.
Mhm.
So these people will assist in the management of autoimmune diseases where the immune system is attacking the
Mhm.
body's the body itself, and tends to attack the joints and cause a lot of inflammation.
Rheumatoid
So
arthritis as
right.
well.
So the
Yes.
rheumatologist would deal, and I know, you know, just last week, Carlton, you did the presentation to the Lupus Foundation,
Yes.
from the 5K walk. The lupus patients often need the
Need to see
services of a
That's
rheumatologist.
very true.
Mhm.
That's very, very true. Then we are going to the urologists. Urologists. And we do have, I think, two now, one in attached to the hospital and one private. Well, both
Okay.
of them are attached to the hospital.
Okay.
But one is foreign and one is local.
Okay.
Yes. So we have a urologist now on island for all the men that have issues. So the urologist deals with the male sexual and reproductive organs.
Mhm.
So that is the penis, the testicles, the prostate, everything that relates to the male reproductive system. The urologist take care of that.
Mhm.
So you're having erection problems, the urologist. You feeling one of your balls is way bigger, one of your testicles is way bigger than the other, the urologist. You feeling pain in your testicles, the urologist. You seeing blood or some type of discharge coming out from your penis, the urologist. You having prostate issue,
issues.
the urologist. You having, let us say, premature ejaculation, the urologist. So everything to do with the male reproductive system,
Mhm.
even gynecomastia, where men end up having big breasts, you know, like women. That is a medical condition we call gynecomastia. That is related to a hormonal issue. Again, the urologist would be able to deal with that as well.
Oh,
But
so the
sometimes the
endocrinologist.
urologist may even send you to the endocrinologist
Yeah, for
to
that.
get certain tests done,
Mhm.
and then they might decide to see who else, how they work along with each other.
Mhm.
But it's a very interesting thing.
Yes, Carlton, I know the urologist deals a lot of the male reproductive system,
The
but
bladder
also
too.
right, but also women can be referred to urologists for issues of the bladder.
Mhm.
Sometimes if you have frequent urination
That's
or
true.
frequent urinary tract infections, you may be referred to a urologist to see what is the issue. There are certain issues of the bladder that both sexes can experience, and the urologist would be able to pinpoint the cause.
Definitely.
Mhm.
So we do have a urologist on island. If you need to know the person, you can call me and I will give you the number. Then we have the gastroenteritis. Gastroenterologist.
Enterologist, yes.
The gastroenterologist.
This is a big one, Carlton.
Yes.
Well, I mean, when I say a big one, I mean
Let's
a
break it
very
down.
yes. It is one that a lot of people may not know about, but need to see.
That's true.
Dealing with a lot of issues. So yes,
Mhm.
so
So that's a doctor that specializes with the gastrointestinal system. That is the stomach and the intestine, the bowels. So anything from the mouth all the way down to the rectum,
right.
that doctor can deal with it, including the liver and the pancreas.
Mhm.
So they deal with the gallbladder, the stomach, the bowels, the liver, the pancreas, all of these. You're having issues with diarrhea, you're having chronic diarrhea, you're having chronic constipation, you seeing blood in your stool, you're having hemorrhoids issues, you're having a lot of epic pains in the pit of your belly, you're spitting blood, you're vomiting blood. All of this, the gastroenteritis.
Gastroenterologist.
Oh,
Gastroenterologist.
gastroenterologist. I don't know
Yes.
why I'm saying gastroenteritis.
So the gastroenter and interest, all of these things you mentioned, Carlton, somebody might experience them, the stomach pain, the diarrhea, maybe, and automatically think of the digestive tract,
Mhm.
and maybe intuitively think they have to see a gastroenterologist.
Mhm.
But there are certain things, symptoms that people may not even associate with the digestive tract, and they are associated with a digestive issue. So, for instance, one is excessive coughing,
Mhm.
or a long-lasting sore throat,
Mhm.
long-lasting nausea and feelings, to vomit after you eat, maybe. But the coughing in particular is one that has taken a lot of people,
That's true.
because that's a classic acid
Yes,
reflux sign.
That's true.
And some people, because it's coughing, they figure it's a respiratory
And they buy
issue.
cough medicines.
And
Mhm.
right, so they don't think of the gastroenterology, so it being a digestive tract issue, but acid reflux. And that's why I said this particular specialist is very well, a lot of work for that person as well, because a lot of people suffer with
Yes.
gastric issues.
In our
acid-
lifetime, we all will end up having a gastroenterological
yes
issue.
is
Mhm.
it acid reflux is extremely common, or what we call gastroesophageal reflux disease.
Yes.
Good.
Yes.
So you hear certain people complaining about certain things, and if you suffer from acid reflux like I do, you say to yourself, oh, that is they don't even realize that is what it is, and they
Yes.
maybe need to see the gastroenterologist. Let that person do we spoke about it,
Yeah,
a gastroscopy, look
Mhm.
into the stomach and see what's going on, and make recommendations a lot of times on lifestyle changes and medications that can be taken to ease up those symptoms.
Well said.
Mhm.
So what we're going to do, we're going to take a short break, and then we will resume explaining to you the different specialities and what they mean.
Introducing Jolly's Pharmacy, brand new website, www.jollies.gm. It's your time to jump the line. Shop now at jollies.gm and have your items delivered in the comfort of your office. No more standing in line. No need to use your lunch hour to shop. Hassle-free shopping, safe and secure. Jollies.gm features rush delivery, 1 hour. In-store pickup, regular delivery, 5 p.m. Cut-off time, 4 p.m. It's your time to jump the line. Visit us at www.jollies.gm. jollies.dm. Jollies Pharmacy, leading the way in healthcare.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Lando with co-hosts Jacinta Fagan Defoe and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
I woke up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. Great and down in Josh Street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and take on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up your immune system, Jolly's walking. Yeah. Yo, Dominic, it's your boy Father Fox. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Yes. So we're back with you. Those who may want to ask questions, let me just give the numbers again. 449-3095, 449-3096, 449-3097, 616-4257. If you reside in overseas, you can always call to make a contribution as well. That number is 305-432-9624. That number again, 305-432-9624. These are the numbers if you want to just make a contribution or ask a question. We do have quite a number of people making comments on the Facebook page as well. I don't know if Trudy may want to read a few if she gets a chance, but we want to acknowledge you, Glenda Shillingford. I'm seeing you. There's a Julie St. Louis. I'm seeing you.
Just in
and,
your eyesight, yes.
Yes,
Julie St. Louis.
Yes, I can see far.
Yeah, so good morning to our Facebook listeners. If you're listening on radio and you want to jump across Q95 FM Radio's Facebook page, is the place to see us live.
All right, so we continue. So we are down to the dermatologists. Derma, when you hear derma, it's a prefix of the word that means skin. And so it's really a doctor that deals with matters of the skin, acne, skin allergies, moles, scars, sun damage, skin cancers as well.
Even fungal infections, yes,
as well
of the
So you
skin.
may feel like you have loot all over your body, or you have psoriasis, or you have eczema, or you have contact dermatitis. You see something on your skin that's taking over. It's not supposed to be there. Again, the dermatologist is a person that you need to see. They often do biopsies as well, where the dermatologist might take some cells, tissues from the skin and send to the lab to test to see if it's something that may be cancerous. So they do that as well. I see we have a caller. Let's take this caller.
Good morning, Mr. Lando.
Good morning to you, caller. Thanks for calling.
I was just calling to ask you, what was the number you said to call to verify your spot to do the pap smear and the breast test?
Jolie's number.
Jolie's number. That's 448-3388.
Okay, thank you very much.
Thank you so much, too. Okay. Then we have the endocrinologists. Endocrinologists. And Trudy, you want to tell them?
Yeah, so
Ali.
So endocrinology is the specialty to deal with hormones. The hormone system, or the endocrine system, as it's called, is the second control system of the body. The nervous system is one, so the brain and the spinal cord and the nerves are very important to control everything that we do. But our hormones, those chemical messengers that we have, control the other half of what we do. So down to things like growth, the regulation of our blood glucose, our metabolic rate, our reproductive
thyroid
cycle. Yeah, so all these different areas are controlled by hormones. And so the endocrinologist is the specialist that you go to for conditions to do with your glands that secrete hormones. So, in case you don't know, things like your thyroid gland, that's that gland in the neck that secretes the hormones that are responsible for regulating the metabolic rate.
Testosterone
The
level,
the different hormones that
progesterone.
regulate the reproductive cycle. So the testes secretes hormones, the ovaries secrete hormones, the brain, the pituitary gland in the brain secretes a whole bunch of hormones. So people may go to the endocrinologist for issues like diabetes, which is also a hormonal issue, reproductive issues like polycystic ovarian syndrome, once again, is hormonal. Sometimes growth issues, the growth hormone is responsible for controlling growth. So if you have a child that's not growing as they should, the endocrinologist might be able to pinpoint that. Any issue with certain hormones that we maybe don't even hear about much, like the adrenal gland hormones. So there are a lot of hormonal diseases, and sometimes people go for certain things, certain symptoms it doesn't reflect any other type of condition, and they're very confused. Sometimes the endocrinologist is the person to sort out these confusing set of symptoms. One, Carlton, that's very common is thyroid diseases. So people have hyperthyroidism or hypo. The thyroid is either overactive or underactive. Sometimes people just feel tired, they don't understand why, or they just feel jittery and they don't understand why. So the endocrinologist, and we do have one here, Dr. Natasha Maxim Esprit. So we have one endocrinologist, and she recently started her practice. So we can access that service locally.
Then we have the surgeon. So we have the surgeon who basically does surgeries, removal of organs, repairing of organs. You have a laceration, there was a bad accident, the surgeon comes and they do what they have to do. We have 2 local surgeons on island. Yes, 2. Yes.
I know 2. I don't know if we have more.
I don't know if there is anybody else in the hospital, but I know we have 2 local surgeons on island. And sometimes, again, your doctor, even another specialist, may refer you to the surgeon, particularly if there's a growth. It could be a hemorrhoid. Yes, the gastroenterologist has diagnosed you. That person may refer you to the surgeon to do surgery on it. Okay.
And then and even things like, Carlton, to removal of gallbladder stones, or the removal or the appendix, right? So some surgeries the surgeon might be called in for, might be elective. You actually planned that surgery, or an emergency surgery as well.
That's it. Then you have the psychiatrist. This is one that many people don't necessarily like, but I have always said, if I had done medicine, that's what I would have specialized in. For whatever reason, I like psychiatry. So the psychiatrists are medical doctors. They treat and diagnose mental disorders. So mental disorders. So they deal with anything that deals with depression, bipolar, schizophrenia, split personality, anxiety, panic disorder, as well, insomnia. A lot of people, you find that you have chronic insomnia, you just cannot sleep for months upon months. You may need to see the psychiatrist. A lot of time people like, for real, I didn't know he's a psychiatrist. Yes, the psychiatrist is somebody that you may have to see for that particular. And again, they would not just listen to you, but they would also, in the rule of send you to do certain tests, because they are medical doctors,
and they can prescribe medication.
That's it. Right? So if you're having mood issues or your behavior has changed, you recognize that somebody is not thinking rational. They also diagnose things like Alzheimer's and dementia as well. right? So they deal with that too. Then we have the anesthesiologist. We have one,
Yeah, Dr. St.
Dr.
Louis.
St. Louis. So that's the one that administers the sedatives and the numbing medicines to put you to sleep when surgery is going to be done. I find that profession is very it's a risky one.
Yes, it is risky.
Yes.
I in that same surgery I mentioned earlier to do the correction on the hips, I had an allergic reaction to the anesthesia,
Yeah.
and that was in Martinique.
Wow.
And this is a very scary thing
Yeah.
when a patient, does not take the drug well or has a reaction to the drug. And so that field, the anesthesiologist, it's a very precise type of work. The person has to be very careful and know a lot of detail to be able to use the correct drug.
Dose.
Yes. In other countries, well, I don't think here, but there's nurse anesthetists. I have a cousin who is in the United States in this profession, and the nurse who actually administers things like epidurals to patients when they having babies,
Yes.
right? So epidural is a form of anesthesia as well, because it numbs the body, the lower half. So in other countries, there is the nurse side of this specialty, the nurse who can actually administer certain anesthesia. But the anesthesiologist is the doctor who is specialized in that, and knowing those drugs. It's a very risky thing. It is
cocktail.
Yes.
I remember when I was doing my surgery. I remember Dr. Gay was his name. And he from Queen Elizabeth Hospital, and he just said to me, okay, he introduces, and he said, okay, Carlton, all I want you to do for me is to count backwards 10 to, and I don't know what number I stopped on, but I don't think I reached on 5 because it's intravenous that gets into your vein, and that was it. I don't think I reached maybe 10, 9, 8, and you just see in your eyes,
and you were out.
That's it. So I think it's a very interesting area. Again, it's not one. I mean, this particular doctor we have here, he's also a general practitioner.
Yes,
so
yes.
But
patients.
in terms of saying I'm going to see him, but a lot of them, they also deal very well with pain management. These doctors.
That's true.
Yeah.
So, and also they do work in correlation with other specialties. So for instance, if you're going to have a gynecologic procedure and you need to be put under anesthesia to do it, you have to consult with the anesthesiologist prior. If you're going to do a gastroscopy and you want to be put under, you need to consult first. So oftentimes one of the other specialties will send you to the anesthesiologist to do a consultation before the procedure, because the anesthesiologist needs to know your details before they just give you the drug. So it's a very critical specialty, which the other specialties rely on for a lot of medical procedures.
Definitely. Then we have the nephrologist, and that is the doctor that specializes in kidney diseases. We have one native, one local person that has specialized in this area. She heads the dialysis unit
at the hospital.
Yes. So the nephrologist treats kidney disease and mineral and fluid imbalances linked to kidney disease. They also treat high blood pressure as well. So the nephrologist, in some cases as well, they can also perform surgery related to the kidney.
Carlton, and this is an interesting one. Just from my biology perspective, I want to explain, because people might see nephrologist and say, but what kidney? Where the word nephrologist comes from? But the functional unit of the kidney is a little structure called a nephron.
Yes.
It does the whole function of the kidney. We have millions of them in each kidney, and it actually does all the filtration process and the creation of urine, that little structure. So the nephrologist, that's where the name comes from. from. So it's the kidney doctor, but the word comes from nephron, which is a structure in the kidney.
Nice. Another area that I find very interesting before, let's take this color. Good morning to you, caller. Thanks for calling.
Good morning, Mr. Lando.
Good morning to you.
I have been having stomach problem, but I never really go to a doctor. I've suffered H. pylori, but then now my stomach has been giving me problems and problems. But I don't really know which doctor to go to.
Dr. Sanchez.
Dr. Sanchez.
Mhm.
Okay.
Dr.
Yeah.
Sanchez. He's the
That's the
gastroenterologist.
the doctor on Hillsborough Street.
Yes.
Oh, okay.
Yes.
All right.
Okay.
Thank you.
You're welcome. Okay. Right. So we will get into the radiologists, and that's another very that particular specialty is very physics. It's like you can you imagine you do this slide, an MRI or a CT scan, and this person has to look at that image and can tell if you have a tumor, if you have an inflammation by looking at you and then, well, what the hell? I mean, where do they see that? So it is. I was told that it's one of the specialty that has a lot of mathematics in it. A lot of mathematics. Good morning to you, caller. Thanks for calling.
Good morning, Carlton, Mr. Lando, and good morning, Miss Judy.
Good morning to you, my dear. Good morning.
I just called to tell all you thank you for such an educational and informational program you are having this morning.
Thank you so much.
Thank you.
Thank you. Thank
Because
you.
you open a lot of people's eyes as to where they
Yes.
should go and
Yes.
where they shouldn't go and
Yes.
how they should handle things.
Thank
A
you so
lot of
much.
people maybe didn't know that because a lot of people have in certain problem and they will go to a general practitioner, and the general practitioner they will refer them to the person that can maybe handle that situation for them. Thank you very much.
Thank you so
Bye-bye.
much. Thank you, caller. Yeah, so the radiologist basically works with x-rays and images, so whether it's CT scans and MRIs, and they again, whether you're a specialist, another specialist, or a general practitioner, you rely now on the expertise of that radiologist to tell you what is the matter with
the
that
result
person.
of the the
Yes.
scans.
So you can imagine what it's like doing that.
Right.
So people really rely on your word to take the next step, whether it's to do surgery, whether it's to do chemo, whether it's to
what
remove
is
an
the treatment
organ,
plan?
whether
Yeah.
it's to treat, they're relying on you. So the radiologist is very, very, very important.
Right.
Yes.
Yes. Carlton, I have a listener who mentioned that we do. Earlier, I mentioned we don't have nurse anesthetists in Dominica, but the person is saying that we do have. So I just want to correct that. If you know, for if the person who is a nurse anesthetist is listening, I wasn't aware that we now have this in Dominica. So that's good.
All right. Awesome. Then we have the cardiologists. Cardio, heart, blood vessels, arteries, capillaries, veins, everything to do with the transportation of blood back and forth. The cardiologist deals with that. So the heart, the blood vessels, heart-related issues and diseases, everything to do with the circulatory system, the cardiologists will deal with that. So let us say you've done, your GP sent you to do an ECG and an echo, and the results are in, and they're saying to you that you seem to have an enlarged heart, then they would more likely refer you to the cardiology clinic at the hospital. We have Dr. Andrew.
Dr. Rachel Andrew, yes. She's been on this show before. And one of the important things I remember when she was on that she mentioned that she deals with a lot is hypertension. So hypertension, a lot of people, just push it aside as being trivial, but high blood pressure is a disease of the blood vessels. So the blood vessels are experiencing that constant high pressure. There may be blockages in the blood vessels. So she, as the cardiologist, also deals with a lot of issues surrounding, as she mentioned, high blood pressure, which is a very common medical condition here.
Right. And if you have peripheral arterial disease, That is where you have a lot of what we call what do you call this again? I want to get the easier name for it, but you have a lot of varicose veins. So you have a lot of varicose veins issues, and they're hurting. It's relating to the arteries that are being clogged. Again, the cardiologist is the specialist that you'd want to see for that if you're someone that is experiencing that type of discomfort and pain, particularly in the legs. Okay. Then we have the pathologists. That's another area of medicine that I really like. It is what they call lone ranger. Most pathologists work behind the scene, but they are very, very important. So when the cells are taken from the organ, they are sent now to the lab, and the pathologist now has to break down those cells to diagnose what is the problem.
So to visualize and see what is the issue. Yes.
That
So
is very
important
interesting.
for diagnosis.
Because I remember when my sister, who has lung cancer, was diagnosed, because I did not. There are 4 different types of lung cancer, and then they had to do like further dissecting. So that biopsy took like about a week and a half, because they had to use certain dyes and whatever, from what the oncologist said to me, to be able to see which of the lung cancer she had. And that was really interesting to me, right?
Yeah.
So the pathologists also are the ones that does the post-mortem. So someone has died.
And I think that's what
And
most people
that's-
think of the
yes,
pathology
yes.
for, though, is the after death
yes, but no.
function. Yeah.
They are the ones that will, when that biopsy, specimen is taken, that they are the ones that will do the testing on it to confirm whether there is cancer or there is X or there is Y. But the biopsy part, I was speaking to Dr. Bellot, Peter Bellot, who worked at Ross. He's a pathologist by profession, and and we had a real good conversation, and I was so intrigued. I was like, wow. Like, I was asking him, like, how can you tell what time somebody died? And he was talking about the changes of the skin and the changes of the blood, the texture of the blood, and all of that, and certain images in the eye. They could tell you what time the person died, the estimated time, and how the person, and that intrigued me. And I was like, that's something I think I could have done. It didn't quiver me at all.
Okay.
It really did not gross me out. Because I find that it's a very investigative area in medicine to be able to really, and then you still have the forensic pathologies that goes even beyond that they can take your teeth, the teeth, and they can actually do DNAs and find out, who you are and all of that. Good morning to you.
Another question I'd like to ask you, on the question of pathologists, do we have a Dominican-born pathologist here, or we have somebody here whenever this kind of procedures have to take place? They will take the samples and send it over to them. Or do we have somebody residing in Dominica that can do that? And I used to love looking at
Grey's Anatomy. Grey's Anatomy.
No, there's another name there towards that program, to see when a person die, they cut. They did a real autopsy on them. Cut
Dr. G.
open their
Dr.
head.
G.
Dr. G or something.
Cut open their head.
Mm-hmm.
I said, what? They doesn't do that. I definitely doing that in Dominica.
Yes, they do. They do it in Dominica.
Cut open your head
Yes.
to see what you die
It
of.
must get into the brain.
Cut open your chest,
Yes.
your back, your
Yes.
stomach. But
Yes.
I started having nightmares, so I stopped looking at that.
Yes, well, it's done. It's done. I do know that we have resident pathologists on island. I know that there is a Dominican who worked in Dominica as a pathologist, but now she's at Queen Elizabeth Hospital. Dr. Dupy, she's the chief pathologist at Queen Elizabeth Hospital in Barbados. But yes, autopsies are done every week in Dominica.
Okay.
And So it's the same standard where, yeah, they open up the brain, they have to weigh the organs and all of that. So it's a very, it's an area not for everybody, but I think if I had gone into that's an area I would have maybe liked to.
Yeah. Okay, we have a call coming in.
Let's take this call. Good morning to you, caller. Thanks for calling.
Hello, good morning.
Good morning to you.
Do we have any neurologist here? Somebody who deals with the brain?
Yes, we do have one now. She is Cuban and she's working with Dr. Andrew, I think. She does, but if you call Jolly's, I will be able to give you that number. If you give me, like, let's say if you call me by 12 o'clock.
Okay, no problem.
Okay.
Thank you very much.
All right.
Right.
You're welcome.
Yeah, Carlton, some of my nurse listeners are saying that, well, I'm getting some messages that we do have other local anesthesiologists. We mentioned anesthesiologists earlier, and so I'm getting the information that we do have other local ones like Dr. Alexander and Dr. John Baptist, and as I said, nurse anesthetists we do
They
have.
need to send that to us.
Yes,
because we don't know,
I think what is important as we're having this discussion, and I've always felt this, is we need a medical directory when people, because new people are entering the profession all the time, and you don't know. Of course, there is a very wide array now of specialties, and Dominicans are doing specializations in varied fields, and sometimes you just have information from back then. Like, remember I said when I had to do a surgery, we didn't have an orthopedic surgeon. Now we have 3 or so. So it's important, I think, to have a constantly updated medical directory. I think that's something maybe the health authorities should do, so someone can easily access this type of information when they want to seek the services of a physician. So, okay, I want a neurologist. I want to seek a consult with an endocrinologist. Who do we have on island? You know, what I would do before, I would Google like the specialty, and sometimes it would pop up in the yellow pages, the online yellow pages, but still not everyone is listed.
That's true.
So some doctors are listed, but some are not.
That's
So I
true.
think a medical directory is something that we should look into.
Very good. Very, very true. Again, that's something that the medical board can actually organize. Organize something like, because again, even for me, I did not know that we had
Other
these new people.
right.
Did not know.
And there's a specialty, Carlton, as just before we have to end and I forget. Ophthalmology is
Yes.
another specialty.
Yes.
That is the eye. So this specialist deals with the eye, and they can perform surgery on the eye. They can check for glaucoma and eye disease, other eye diseases.
The optometry is different.
Yes, optometry is for the glasses.
Yes.
But the ophthalmologist is
The medical doctor.
yes, the medical doctor that can do, as I said, surgery on it. Sometimes you have an accident and the eye is impacted in that accident. The ophthalmologist is critical
That's true.
to save that eye, because of course you could have something pierce the eye or something, and you need emergency surgery to save the eye and save the vision of the person. So ophthalmology, and I have someone who is just, there's Dr. Shillingford Ricketts, who everybody knows, our long-standing ophthalmologist here in Dominica, but now Dr. Nancy Lawrence has just opened private practice as an ophthalmologist as well. So we are constantly expanding in terms of what we have, specialists that we have, and the directory would be so important.
We also have the internists. Yes, we have, I think, 3 that I can think of. 3 internists on island, and the internist basically is the specialty that deals with the internal organs, investigative medicine, medical matters. So most of the internists would work on the medical wards. So if you go to Glover Ward or Emory Ward, Emory, the one for men, medical ward for men, you will find the internists there, and they have a very vital role to play, and they are also part of the medical team too. Did we forget any? We have the epidemiologist. Is one that works behind the scene. They do a lot of statistical work and research and investigations. This is so we during COVID we were seeing Dr. Ahmed
Mhm.
every other night or so.
But doctor, yes, he's in the position of national epidemiologist. But Dr. Ricketts, Paul
Yes,
Ricketts, was
yes,
our last
yes,
epidemiologist. Yes.
Yes, so that's a person that really looks for potential diseases that could appear, causing lots of problems. So this is another specialty that is available, but it's not one that you would readily go and say, "Well, I need to see the epidemiologist."
No.
It's different. It's one that work behind the scene and will advise the Ministry of Health, would advise doctors. This is what we're seeing. This is what's happening. This is some of the trend that we're seeing and so forth. So these are some of the specialities that we wanted to highlight today with you and let you know. Let me just say quickly too, there is also the clinical psychologist. The clinical psychologist is a doctor, but not a medical doctor. So the clinical psychologist cannot prescribe medications to you. If you need medications for something psychological, then the psychiatrist would be the one that you have to see. But the clinical psychologist basically deals with, talk therapy, counseling, that type of thing. And they are very important as well. They do have a role. They qualify. They're very, very important as well. So I wanted to differentiate between the psychiatrist. The psychiatrist is a medical doctor first, and then they went to specialize. The psychologist is not a medical doctor. So the same thing with the optometrists. They are not medical doctors, but they do have a basic idea of the eye and eye conditions, but there are some medicines that they cannot prescribe and is only prescribed by the ophthalmologist. They cannot do eye surgeries, for example, but they can screen your eye, they can tell you what they're seeing, and in terms of managing glaucoma and cataract and those things, then you have to see the ophthalmologist. That would be some matters that the optometrist would not be able to really handle, and they might tell you, well, this is what this suspect you have, but really and truly the ophthalmologist would be the one to really make that diagnosis. Well, I do hope that the information that we gave today, we know it was different, but I do hope that it sensitized you and you now know the different specialities that are available here. And even if the need arises and you were to see somebody who referred to see another, like with the pulmonologist, we didn't talk about that one. The pulmonologist is the specialist for the lungs. Again, I don't think we have a pulmonologist on island. I want to say I don't think we have one, but that is again a specialty. So people with COPD, breathing problems, chronic asthma, all of these matters of the lungs, the pulmonologist is the person that they might refer you to. You could go to Barbados or Trinidad and you could find somebody there that would deal with this matter. So it is now 11:37. We definitely have to end today's episode of Health Vibes. Don't forget, again, our reproductive sexual health clinic that is going to be taking place next week, Wednesday and Thursday at Dr. Lisa Jolly's office on Hillsborough Street. It is $40. You will get your pap smear done and your breast examination done by a very competent team. We only charging $40. Call Jolly's Pharmacy 448-3388 to book your name and to make an appointment for that clinic. So whether it's the Wednesday or the Thursday of next week. All right. Take care, everybody. As always, your health is indeed your greatest resource. Have a good rest or remainder of the day and blessed week. Bye-bye.
Goodbye.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting